We will now begin today's webinar. This webinar is being recorded so those unable to join us can view the recording at a time that is convenient for them. A link to the recording will be sent to all who registered for this webinar. My name is Katie Ramos, and I am the Executive Assistant to our Executive Director at Goodwin House Bailey's Crossroads. It's my pleasure to introduce your program moderator, Lindsay Hutter, Chief Strategy and Marketing Officer for Goodwin Living. Welcome, Lindsay.
Thank you so very much, Katie, and a very big welcome to the Goodwin House Alexandria and Goodwin House Bailey's Crossroads residents who are joining us today, the Goodwin Living at Home members who are joining us, the members of the Priority Club, and various older adults across the region who are exploring the options that are available to you through Goodwin Living. We're delighted that you can be with us for this webinar. So a little bit about me. Katie gave you my work title, but my family title begins with daughter. And this is a picture of my brother and my mother and me when my mother, at the age of 1 month shy of 95, after our father passed away, moved out to Virginia to live in one of the Goodwin House communities. And I share this because the way we think about serving older adults is as if it were our family. And I had the privilege, absolute privilege of my mother living in one of our communities. I was able to see her when it was safe to do so during the pandemic. And so she was very close to me. Yet I would tell you that if you were to speak with any of my colleagues, when they talk about the residents, when they talk about the Goodwin Living at Home members and the patients we serve through home health and hospice, it's as if we're serving family. So that's the first role that we bring when we come into work every day. As we jump to the next slide, I want to share a little bit about the agenda that's before us. And so you'll see here that we have essentially two topics, one which is going to be a bit of an overview of Goodwin Living and how we're approaching the pandemic, and then the featured speaker, Dr. Margaret Gloria, who will talk to you about the variants, more variants, unfortunately, in the fall flu season and how we can all be well-informed and safe. And then the third part of this program is to receive your questions. And so in a minute, I'm going to give you some housekeeping notes on how you can be submitting questions during the program. And please feel welcome to do so. We often find that viewers hear something that Dr. Gloria says, and they want to learn more or better understand a point that she's making. So be active in the question submission box. As we do shift to the next slide, I want to share a little bit about Goodwin Living and who we are. Our residents and our members could probably recite this just as well as I could, but a few key things to know about us. And the first is our mission. It's to support, honor, and uplift the lives of older adults and those who care for them. So when I referenced earlier that we as team members feel that those we serve are family members, that's that reciprocity, that being in a family-like relationship. Our vision is to expand the ways and places that we serve older adults. And we are so blessed to have resources to grow our mission and serve more older adults. We've actually grown our mission considerably during the pandemic. And in a moment, I'm going to share with you some exciting news just finalized yesterday about further growing our mission. And then finally, what's the approach that we take to serving older adults? It is first and foremost a faith-based approach born out of our roots in the Episcopal Church, and we are not-for-profit and we are mission-oriented. I would tell you that while our roots are in the Episcopal Church, we welcome and celebrate all faiths and worldviews that people may have. Think of us as a welcoming organization for wherever you are, whatever you are, and whatever your needs. We'll seek to meet you there. So as we flip to the next slide, we get to share with you some very exciting news. And that is yesterday, Goodwin Living completed the purchase of a senior living community here in Alexandria, formerly known as Hermitage, Northern Virginia, part of the Pinnacle Living Organization and Methodist in its faith tradition. We are honored and feel very entrusted to be able to continue the faith-based not-for-profit mission of this community And we'll have now about 110 residents and a little over 100 team members who are now part of the Goodwin Living family. The approach of this new community, which new to us, and the new name is The View Alexandria by Goodwin Living. And the approach is a rental community, so it's not a buy-in entrance fee model, the way Goodwin House Alexandria and Goodwin House Bailey's Crossroads are structured, but it's a rental community. And we plan to continue with that option, which is another option that older adults can select from in terms of how they choose to fund their retirement and where they choose to live. So from our hearts to the hearts of all our new residents and team members at the View Alexandria, we say a big welcome. As we shift to the next slide, it gives you a broad overview of all of the ways that we serve older adults wherever they want to live. And the first option I would point out, and that's at the very top row, is Goodwin Living at Home. And that's an option that we make available to older adults who said, I love my home, I loved where my family was raised, my neighborhood, my garden, whatever it may be. And we provide what is a long-term care like insurance product that will help pay for care as that care may be needed over time. And that can be care delivered in the home, or at some point, if the older adult says, you know, I think I do want to move into a senior living community, then it helps fund the cost there. And that's for older adults 55 and up. And it's available to older adults in Virginia and also Washington, D.C. Many of you have heard of Goodwin House Alexandria and Goodwin House Bailey's Crossroads. They are our two full continuum life care contract communities, one in Alexandria, one based in Falls Church. I mentioned just a moment ago that we have a new member of the Goodwin Living family, and that's the View Alexandria, which is a rental community, and it provides independent living, assisted living, and long-term care for older adults 62 and above in a faith-based, not-for-profit, and monthly rental approach. An option that we have is what we like to call and. You could start out living at home with Goodwin Living at Home and have not only the financial support of that program, but the coordination of any care that you may need that's provided as part of Goodwin Living at Home. And if you choose to move into a Goodwin Living community or another senior living community, those benefits transfer with you. And lastly, I want to make you aware that Goodwin Living is the managing agent for a retirement community in McLean, Virginia. It's called the Lewinsville Retirement Residence. And this is a Section 202 senior living community that supports low-income older adults. And it's been our honor to support the Lewinsville and its residents for many, many years, and we hope to continue to do that well into the future. So those are the ways that we support older adults where they choose to live. We also support older adults around how they want to live and how they need to live in terms of healthcare services. And this next slide gives you an overview of services that we offer our residents in our communities, our Goodwin Living at Home members, and older adults wherever they call home. Could be their home that they've been in many years. It could be another senior living community where we bring these services in. And these include our Medicare certified home health, which is a wonderful service for older adults that perhaps have had an injury or a surgery, and they need some assistance with getting back to their level of independence and mobility. Our nurses, our therapists can come into your home and provide these services. We have rehab services, and then we also provide hospice and palliative care. So these are some of the services that we take out all across the region. Doesn't require you to move into a Goodwin Living community to obtain these. You may obtain these services wherever you live. As we move to the next slide, I want to introduce what is a more recent addition to the services we provide older adults. For many years, Goodwin Living has been honored to be able to serve our residents who had cognitive challenges. And we've done so with our memory care communities within our communities. And these are areas where those residents can live and receive the care and the devotion that they need by trained professionals. And in 2019, there were two things that converged. And one was we could see that more and more older adults were saying, that's wonderful that you care for me when I have cognitive decline. What can you do to help me maintain my brain health? What are the preventive measures that you can introduce to me? So that was one factor. The other factor was our new CEO at the time, Rob Liebrick, who joined us in July of 2019, brought to Goodwin Living a curriculum that Rob and his family developed for their mother, Wendy Liebrick. And that happens to be Wendy's warm smile and wonderful photo that you see. Wendy had started to experience some forgetfulness, and the family took note. And Rob, who was in senior living at the time, said, what can I do to support my mother? Surely there is something that can help us prevent this decline. And Rob was aware of some programs, but there wasn't anything that was as complete and ongoing as he sought and non-pharma related. And so the family developed a program which they call Stronger Memory, and they have given that to Goodwin Living. And we have now introduced that to our residents, our Goodwin Living at Home members. It has been adopted by the state of Maryland Department of Aging for their senior centers. We'll soon be rolling it out to senior centers across Virginia. The Village to Village Network across the United States has adopted it. And so you can see that right now, we literally are serving about 7,000 older adults with a Stronger Memory curriculum. We are able to make that available thanks to the generous donations of donors to the Goodwin Living Foundation. And that funds this curriculum. It's available online and has three components to it. The first component is essentially, and these are activities that we want older adults to perform each day, reading aloud. You can read a book, you can read the newspaper, but read aloud for about 20 minutes. The second activity is longhand writing, not typing on your laptop or your tablet, but actual longhand writing. It could be poetry, it could be haiku, it could be journaling. And the third is simple math calculations. And so Wendy is showing you on the left side an example of the math calculations. And then you can see the overall curriculum book. Again, you can download these on the Goodwin Living website at no cost, thanks to the generous donors to the Goodwin Living Foundation. So I encourage you to take a look at Stronger Memory, our brain health program. I'm going to transition now, and we're going to talk a little bit about how Goodwin Living has been navigating COVID and the pandemic, and in four ways. The first is very conservatively. We've taken a conservative approach to mask wearing, to testing, to PPE, to all of the foundational elements to protecting those that we serve and those who serve. We've also been extremely respectful in trying to welcome everyone in the Goodwin House family into all of the benefits that they can receive through the resources we have. We have also been respectful of other community partners and senior living organizations when they didn't have access to as much PPE. We engaged in group buys for PPE, and we also produced a playbook on all of the protocols that we set up and the practices that helped us stay open from the very earliest days of the pandemic and keep our residents, our team members, and our members safe. And that playbook, it's on our website, free of charge to anyone that might want it. The third way that we've approached the pandemic is hopefully. Hopefully in the sense that we knew that there were many public servants, many pharmaceutical professionals who were developing vaccines, developing treatments to help us all stay safe as we learn to live with COVID and its many variants. And then finally, we've approached it with a sense of purpose and fulfillment. We viewed it as a time to learn how to come together as a community within each of our senior living communities, within the Goodwin Living family, within the broader region around us, and find purpose and find meaning. There are so many stories of the way that our residents and our members tutored young people remotely when schools were shut down and would do virtual tutoring. And that's just one of the many ways that we found purpose and fulfillment during the pandemic. The last thing I want to share before I introduce our featured speaker is that we approached the pandemic recognizing the importance of our team members. We always valued our team members, but it became so clear that these were the heroes who were prepared to walk into our communities when we didn't have vaccines and say, we're here to care for the residents. We're here to go into the homes of our Goodwin Living at Home members and care for them because they are our family. And so our organization has made a tremendous commitment to support our team members with a living wage, with grants when they needed it, when the pandemic was at its worst and their family members may have lost their jobs. We have done everything we can to keep our team members safe and whole in their lives so they can stay safe and focused on serving our residents, our members, and those we serve through healthcare. We're very proud that our efforts have earned us for the last 4 consecutive years to be a top 10 Washington Post workplace in the National Capital Region. So I want to salute our team members because they are so dedicated and have helped us keep our residents, our members, and all those we serve through healthcare safe. Now, before I begin the presentation with Dr. Gloria, I want to review a few housekeeping notes on this. And as a reminder, there'll be an opportunity for you to ask questions through the chat function, and that will be live on the screen a little bit later in the presentation. And you can also look at what should be a box on the right side of your screen, and you'll see chat, and you can type in your questions there. So without further ado, it is my pleasure to introduce Dr. Margaret Gloria. She is the medical director of Goodwin Hospice. Since the pandemic began, I have had the pleasure of serving alongside Dr. Gloria on our infection precaution and planning team. And that team leads all of the protocols and the efforts that we undertake to keep our members, our residents, and our team members safe and provide support to the broader region. Dr. Gloria is smart, calm, and wise, and these are attributes that have served us well during these now 2.5 years of the pandemic. Dr. Gloria completed her fellowship training in hospice and palliative medicine, as well as internal medicine at George Washington University. She is board certified in internal medicine and hospice and palliative medicine by the American Board of Internal Medicine. Dr. Gloria proceeded a step beyond the ABIM certification to earn the Hospice Medical Director certification, which is rare in the United States. Prior to joining Goodwin Living, Dr. Gloria served on the inpatient palliative care team at George Washington University Hospital. That concludes a lot of the professional, I shouldn't say concludes, because she has a lot of other certifications and honors. She was just recently awarded a 40 under 40 outstanding citizen here in the city of Alexandria by the Alexandria Chamber of Commerce. She's authored papers, she's served in nonprofit organizations, and the list of her accomplishments and contributions is long. However, I'm going to get personal for just a minute, and that is to tell you that Dr. Gloria served as the hospice medical director over the last 8 months to 2 people who were very near and dear to me. First was my mother, and she served my mother through the transition from this life to heaven. And most recently, she served one of my best friends through her transition to heaven. And so I just want to say from my heart that I would trust Dr. Gloria with anything, because we trusted her with our mother as a family. And so know that you are in incredibly calm, tender, and capable hands with her presentation. Dr. Gloria, thank you for so much, and thank you for the time you're spending with us today.
Thank you for such a warm introduction, Lindsay. Welcome to everyone who's joining us for the first time, and welcome back to everyone who has been with us previously for one of our webinars. We've talked previously about pandemic versus endemic and what that looks like, where pandemic is when we're seeing case numbers that are quite high and seemingly out of control, whereas endemic looks closer to what the seasonal flu would look like, where we're seeing only spikes around the fall and winter time. To be honest with you, I think for better or worse, we're closer to endemic now than we ever have been. In fact, I think we're about there. I think we will continue to see cases spike in the fall and winter, and then also, of course, when there are new variants. hopefully the waves that we continue to see in the future are not as large as we've seen in the past. And since we're starting on a personal note, I'd just like to add that I traveled recently. I flew from Washington, D.C. to Chicago. And when I got to the airport, I have to admit, I was shocked to see that of the hundreds, if not thousands of people that were inside the airport, very, very few were wearing masks. For someone like me who still lives very much in COVID every day, both as a hospice doctor and also as a medical director for Goodwin Living, I couldn't reconcile what I was seeing in front of me and the way that I feel personally about wearing a mask in public and certainly on an airplane, etc. But I think that this is where we are now. Very understandably, a lot of people are tired. They're tired of restrictions, tired of all the things that we've sacrificed during this pandemic, and I understand that. So for the webinar today, we're going to focus on how to keep ourselves safe living in this age of COVID-19. Okay. All right, I'm going to wait just a moment for the slide to advance. There we go. And the next, we're going to talk about Omicron specifically. That's the flavor of the day. There we go. All right, so as you've all heard, we have a new Omicron variant on the scene. This is BA.5. This is the most transmissible variant that we've seen yet. I know everybody's tired of hearing that. This variant is so transmissible that it can even be transmitted outdoors for brief encounters. So previously, when we thought about transmission and risk, we thought about being within the same space as someone for 15 minutes or longer, being indoors, and it's just no longer the case because Omicron BA.5 is so transmissible. We're seeing a lot of repeat infections. It's because BA.5 is better at evading the immune system, and whether that's immunity from a vaccine or even natural infection, we're seeing reinfection, if you will, in both cases. It's still too early to know whether or not BA.5 is more virulent than previous Omicron strains. Initially, there was some concern from the medical community that BA.5 had a predilection for the lower airways, which would make it more likely to make people seriously ill. We're not really seeing that so far, but it's something that we're definitely keeping a very close eye on. It doesn't as commonly cause loss of sense of taste and smell, and it also doesn't as commonly cause shortness of breath. And again, that just goes back to, so far, it's looking just like its other Omicron cousins. It doesn't really prefer the lower airways, and therefore it doesn't cause shortness of breath, which is a good thing. Otherwise, the presenting symptoms for Omicron BA.5 are very similar to what we've seen for Omicron in the past. Vaccines are still protecting us, although maybe to a lesser extent, and not in the way that you would imagine. And so we're going to talk about that in more slides coming up. All right, so on the next slide, you'll see a very familiar graph if you've been to one of these webinars before. I usually get my graphics from the New York Times. They are the exact same graphics that are available from the CDC. The one that I'm using today is from the CDC. I typically use New York Times just because I think they're prettier. Don't tell the CDC I said that. But anyway, let's look at this graph. This is the daily number of cases reported nationwide, so for the entire country. And the number of cases is on the left side of the axis there. Along the horizontal axis is the time. So all the way to the left is the start of the pandemic. All the way to the right on that graph is present day. So Faith, if I could ask you, maybe you could use your pointer to point out the very first wave, like real wave, right around November of 2020. Yep, exactly. We've looked at this before, but just as a reminder, and for those that haven't gone through this with us before, this is the original wave that we had in the winter months of 2020. This was before we had vaccines available. This was before we had treatments like Paxlovid and Evusheld available. And it was a time where we were experiencing serious shortages in personal protective equipment, so dark days. The next little blip that you see on the graph that's taking place in September of 2021 is the Delta variant, if you all remember. Yep, thank you, Faith. We had a little spike in cases because of Delta. Then the next blip that is huge, you can't miss, is Omicron. So the original Omicron strain last winter we were seeing close to 800,000 new cases being reported every single day, which brings us to present day. So we're seeing a little bit of a spike now from BA5. I expect that spike is going to go up just a little bit in the fall and winter months. If you kind of step back and look at this graph, you can see that generally when these variants strike and when case numbers really go up, it is around the fall and winter months, which is very typical for what we see with the flu. That's exactly why we call it cold and flu season. So going into this next cold and flu season, looking at COVID-19 specifically, I expect that we will see a little bit more of a wave than what we're seeing right now on this graph, but hopefully it's not too much more. All right, so let's look at the next graph. The next graph represents the number of deaths that are happening daily nationwide. So similar to the first, the number of deaths is on the left side axis, and along the horizontal axis is time, starting from the very start of the pandemic to present day. So when you first look at this graph, this can be very intimidating because this is a lot of death to look at. But really, if you think about the graph we just looked at, in winter of 2020, when I mentioned that we didn't have vaccines and we didn't have as many treatments available, we were seeing 200,000 new cases being reported of COVID-19 every single day, and we were seeing 3,000 deaths every single day. But compare that to the Omicron wave. If you look at this graph, you almost wouldn't recognize which one is Omicron because the wave isn't that high. In reality, during Omicron, we had 800,000 new cases being reported every single day and comparatively less than 3,000 deaths every day. So what does that tell us? That tells us that fewer people are dying from COVID-19. We're going to talk a little bit more about why that is, but just to ruin the surprise for you all, it has to do with vaccines and treatments and mitigation strategies that we're using. Right now, you can see on the curve, we're among the lowest that we've been as far as deaths go. We have about 500 deaths nationwide every single day from COVID-19. It's not great. It's certainly much more than the flu, but it's better than what we've seen in the past. And so we're going to talk a little bit more about, like I said, the mitigation strategies and the vaccines and why they're working. But I think we've talked enough about death for right now. So let's move on. We'll talk about how we can protect ourselves. All right, so in the next couple of slides, I'm going to talk in a little bit more detail about masks. It's been a question that I've had many times in the past, and I have actually avoided at all costs, but I understand the importance. So we'll look at the masks. We'll talk about vaccines again. We'll look at some data. We'll talk about early identification. So really, really important that you have rapid antigen tests available to you at home. They're widely available in pharmacies now. Again, there was a time when there was a huge shortage of these tests, but no longer. Now they're easy to get a hold of. Most insurance companies will cover rapid antigen tests through your insurance if you get them from a pharmacy like Walgreens or CVS. And then otherwise, you can order rapid antigen tests like this one through the post office. You just go online and fill out a short form and they'll mail it to your home for free. So early identification is key for two reasons. One, so that you cannot spread COVID-19 to other people, because of course you have to recognize you have it before you're going to be able to implement strategies to not spread it to other people. But the second reason is because early treatment is very important, particularly if you have any risk factors for severe COVID-19. So Paxlovid is a wonderful medicine. It's been in clinical trials. It was shown to reduce the rate of hospitalization and death by 80%, and it's holding almost true to that in clinical practice, which is amazing, but it needs to be started within 5 days of symptom onset. So you don't want to be wasting time delaying trying to find a test. If you have a rapid antigen test at home and you have symptoms and it's positive, you can contact your doctor and get set up with Paxlovid right away. The last way that we can protect ourselves is by following the trends. So similar to the graphs that we just looked at, it's really important to pay attention to the case positivity rate and the trends in your area. So that data is available through the CDC's website, like the graphs that I just showed. You can get pretty specific and look at state levels and also county levels. The same is true for most major news organizations if there's a particular news organization that you subscribe to. The other thing, if you fail to find the information you're looking for on either one of those two sites, you can always go to the local health department's website, and they usually also have up-to-date case information. So really paying attention. I'll give you an example. For me, if case numbers are low, I'm much more likely to run into the grocery store, maybe even without a mask, versus right now in Fairfax County where I live, case positivity rates is sitting at about 20%. So that's a little bit high. That makes me pause before I go into the grocery store or think about putting my mask on and really what do I need so that I can get in and get out, okay? All right, so the moment we've all been waiting for, mask guidance, which is gonna include a little fashion show by Dr. Gloria. I know you're all excited. All right, so let me start out by saying that the masks that I'm talking about today, with the exception of the cloth masks, are intended to be used once and then thrown away. That's how the manufacturers intended when they make them. Since the start of the pandemic, I'm sure you're all aware, we're not doing that anymore. We're reusing respirators and surgical masks even. Generally, when you're thinking about a respirator, whether it's an N95, a KN95, or a KF94 respirator, the CDC recommends that you use it for about 40 hours of wear. So whatever that entails, if you're someone that uses it for an hour or two a week, then it'll last you a long time. If you're someone like me that wears it for long periods of time while you're at work, of course, you're going to get a shorter lifespan out of that mask. Always keep in mind, if your mask is visibly soiled, if it's visibly fraying, if the straps on the mask look like they're loose or they're not fitting to your face or your head as tightly as they used to, that the mask needs to be tossed. What I do and what is generally recommended is I store the mask I'm not using in a brown paper bag because it's breathable versus putting it in a plastic bag. So store them in a brown paper bag. It's best to leave that mask for 5 days if you can and rotate with other masks in between. Okay, so that's how we're reusing the masks. So as we go down the list, we're going to start with the most effective and the most protection that you can get with masks. So that would be an N95 respirator. So I have one here. This is my favorite model. It's made by 3M. There's also, I'm going to go through a couple of ways to know that this is a legitimate N95 mask, and we'll talk again about some of the differences between this mask and say a KN95 or a KF94 mask. I'm going to show you on the front of my mask, but you can also look at the graphic on the slide if you're having trouble seeing my mask. So N95 masks are regulated by the National Institutes for Occupational Safety and Health, so NIOSH. So as long as your mask has NIOSH stamped on the front of it, it's a legitimate, there's mine, see that? It's a legitimate N95 mask, and you know that there have been strict regulatory guidelines that have been followed by the manufacturer when they've made that mask. So all N95 masks should have stamped on them both the manufacturer and the model number for the mask. This one here is a 3M Aurora. It's an 1870. This is, like I said, one of my favorites. The other thing you want to look for on an N95 mask is that it should have a TC number stamped on it. So again, mine is here. Oop, that's not as clear on the camera, but it's there. And then you can also look at the graphic on the slide in case you want to see that a little bit more closely. So N95 masks, unlike any of the other masks that we're going to talk about, fit by strapping around your head, not around your ears. So when I put this mask on my face, I'm going to put the top strap over the top of my head, and the bottom strap is going to go around the base of my neck. Don't cross the straps, keep them safe, or keep them separated. So once the mask is on your face, there's a metal liner in the bridge part of the mask here. You don't want to just pinch it. You want to press it down to conform to the shape of your nose. Pinching it down can leave gaps. So once your mask is on, when you take a deep breath, you should feel that mask kind of suctioning in because it's creating a little bit of a vacuum for you. And that's how you can tell that your mask is fitting well. If you breathe in and your mask isn't suctioning in, or you're feeling like it's very easy to breathe in one of these, then it's probably not fitted well to your face. N95 masks come in many, many different shapes and sizes. So the key is just finding one that fits you the best and that you feel the most comfortable with. I tell people all the time, it doesn't matter how great the filter is in the mask. If it doesn't fit on your face and you're breathing around it, it's not going to help you. Just as an aside, the 95 in N95 stands for it filters out 95% or more of particulate matter. So that's where that comes from. Okay, so I'm going to set this one aside. So now we're going to move to KN95s and KF94s. KN95s are typically manufactured in China. They're not as well regulated by government standards as N95 respirators are, and there are quite a number of counterfeit products on the market. I have read that you have to be very careful because some of the counterfeit KN95 masks are actually worse than just wearing a cloth mask. So when you're looking for a good KN95 mask, we'll talk toward the end of this slide about where you can buy them from reputable sources. But when you're looking at your KN95 masks, also your KF94 masks, there are some similar concepts to the N95 masks. So the name of the manufacturer should be on the mask as well as its designation as a KN95 mask. Whereas N95 masks have a TC number, KN95 masks have a GB number. There's mine there. So you want to look for that number. Side note, if the GB number ends in 2006, it means that that mask was manufactured before 2019, and you probably want to find a newer one. The newer KN95 masks end in 2019. So then you know you're getting one that hasn't been sitting around for years and years. All right, so unlike the N95, a KN95 loops around your ears, not around your head. Once the mask is on your face, you do the exact same thing. You press the metal band down to make sure that it's fitted well to the bridge of your nose. And as you can see, this mask doesn't fit me as well. I can feel air coming in through the sides. I tend to not wear KN95 masks personally because I have a hard time finding one that will fit my face. If you find a KN95 that's manufactured by a reputable manufacturer and it fits your face very well, then more power to you. KF94 respirators are made in Korea. KF stands for Korean filtration. 94 is, again, a designation. It filters about 94% of particulate matter. All right, so the last is a surgical mask. Surgical masks can come in different sizes. I'm sorry, not sizes, that's not what I meant, different colors. So you want to leave the color facing the outside, the white part facing towards your face. If it has a color, sometimes they're yellow, sometimes they're blue. So it also loops around your ears because remember, an N95 is the only one that's going to loop around your head. So you apply the mask the same way, and then again, press that metal band down to the bridge of your nose. Don't just pinch it because that's not going to give you a good seal. All right, I often wear surgical masks personally because I'm not as worried about contracting COVID-19 myself. I'm fully vaccinated and I don't have any risk factors. But just wearing a surgical mask alone can very much reduce your risk of spreading COVID-19 to other people because every time you exhale, it's going to catch all that particulate matter in the mask. All right, cloth masks, probably not a great idea in the time of BA5, probably not going to do a whole lot for you, but they're there for some people. That's their go-to, and that's okay. They can be washed and reused easily. Faith, if you could hit the forward button just once. I put an action on the slide. Oh, it didn't work. Anyway, not surprising. I had listed for you all a website that's called the N95project.org, or not the, just put N95project.org. And that is a nice reputable website where you can go to find personal protective equipment that is known to be trusted by trusted manufacturers. The other thing, if you want to go on Amazon, that's fine. I would go to the manufacturer's marketplace. So for example, 3M has its own marketplace on Amazon, and I would buy anything directly from 3M, or Kimberly-Clark is the other one that I would try and use. So 3M or Kimberly-Clark or the N95project.org to try and get yourself PPE. Okay, thank you. All right, so let's get into vaccines. Important to keep in mind that booster rates in the United States are actually quite low. Of all of the adults that are eligible for one booster, only half of Americans have actually gone out and received it. Of all of the people in the United States that are eligible for 2 boosters, only about a third or less have gone out to get that second booster. So Moderna and Pfizer are expected to update their vaccines by the fall. They have said that they can have their vaccines ready by September. I don't know, it's already August, so we'll have to keep a close eye on that. But this would be the first time that they've actually changed the component of the vaccine, and they've been specifically asked by the FDA to tailor it to Omicron. So hopefully a vaccine that works a little bit better. We have a new kid on the block. It's Novavax's, this is just the name. It's also called Covavax, but in the study itself, it was NVX-CoV2373. It's a whole new type of vaccine. It's called a protein subunit vaccine, so it works differently from the mRNA vaccines like Moderna and Pfizer and from the Johnson & Johnson vaccine. It was just granted FDA emergency use authorization on July 13th. So people are just barely starting to get it, and we don't even have any data yet on boosters, although those studies are ongoing. And again, that's just because it just hit the market, so it hasn't had time. Johnson & Johnson, the vaccine is still available, but it's now only used as a last resort due to increased abnormal clotting events that can actually be life-threatening, particularly in women. So in situations where you just can't get someone one of the mRNA vaccines or the new Novavax vaccine, it's acceptable to use Johnson & Johnson, but again, as a last resort. So I know that some people have been discouraged by new research that shows that immunity against infection dips significantly within 3 months, and that the newest Omicron subvariants are much more adept at dodging immunity than earlier versions. But let's look at some data on these vaccines, and we'll talk about why they're actually still working very well for what we intended them for. Now, really important, this is information, this is data that comes from the CDC. This graph represents data that they looked at in people specifically over the age of 50. So that's exactly why they've recommended so far that people over the age of 50 or people that are immunocompromised get a second booster, because they have a lot of data that supports that it has been very helpful. So remember that this is a specific demographic of people, and it's closer to the best demographic, those over the age of 50. If you look at the left side of the graph, that represents the incidence of COVID-19 infection in the population per 100,000. And then along the horizontal axis of the graph is time. I want you also to take note that this study took place, or the data that they used to make this graph is from April to June of this year. So this is recent data. This is Omicron, one of the variants. If it's not BA5, it might be BA4 or one of the previous, but this is Omicron that we're looking at. So all these things are key. It's very relevant to us, this data. And as you can see, the dark black line is people who are unvaccinated, and the 3 lines at the bottom represent people that have a primary series only, so that's the light blue dotted line, that have had 1 booster, the dark blue line, or that have had 2 boosters, that's the purple line. So just at a glance at this graph, you can see that it is evident that people who are vaccinated are contracting COVID-19 less frequently than people who are not, and that holds true for whether you've had just your initial series or also your boosters. There has been some additional data looked at by the CDC, done specifically in nursing homes, that shows that people that have received their booster vaccine, either 1 or 2, whichever they're eligible for, are less likely to contract and therefore less likely to spread COVID-19. So all of the data is supporting that the vaccines are working. We are surely getting COVID-19 because it's more transmissible and because it's better at evading the immune system. But let's look at the next graph. And we're going to talk a little bit about deaths and vaccination and how those 2 things relate. So similar to the previous graph, this looks at data only in people ages 50 and older. It looks at data between April and May of 2022. So again, we're looking at relevant data for an Omicron variant, and we have the same number of deaths on the left side of the graph and time along the horizontal axis of the graph. You can see another clear representation that people who are unvaccinated, that black line at the top, are much, much more likely to die of COVID-19 than people who are vaccinated. And the trends hold the same for having a primary series, having 1 booster, or having 2 boosters. So as of May 2022, kind of toward the end of when this data set was collected, people that are over the age of 50 who are unvaccinated are 29 times more likely to die of COVID-19 than their fully vaccinated and boosted counterparts. So that kind of, sometimes looking at graphs, it's hard to really put that into numbers and ways that we can understand, but to hear that you are 29 times more likely to die of COVID if you're unvaccinated compared to your vaccinated counterparts, I think really says a lot. And then if you looked further closer at the data, it showed that people who had only one booster were 4 times more likely to die of COVID than people that had actually received 2 boosters. So again, going back, that is exactly why the CDC recommended a second booster in people ages 50 and older or people who are immunocompromised, because the data is showing that for what we care about, which is getting seriously ill or dying of COVID-19, the vaccines really are helping and they're holding true. So as I transition to my last slide, I want to reiterate, when we think about the mitigation strategies that we can use, masking, making sure we have tests, that we are in contact with our primary care providers to get Paxlovid, the most important thing that we can singularly do for ourselves is get vaccinated and boosted according to CDC and FDA guidelines, okay? So in the past, I have told some personal stories. I heard that that went over well, so I decided to incorporate another story from the Gloria family and our new normal. This is in the forefront of the picture, my 11-year-old son. He very recently turned 11, and when he was asked what he wanted to do for his 11th birthday, he said he wanted to take his grandparents bowling, which for Dr. Mom, who again deals in COVID every day, that was the last thing I thought that we should do with the grandparents for his birthday. But we had a conversation as a family. We decided that we would mask. We are all vaccinated. All of us have received the recommended boosters, including the kids. And we really wanted to not take this moment away from him. We were reminded by my in-laws, the grandparents, that it won't be very long that he continues to want to hang out with his family at all. So we took him bowling, him and his brother, and you can see here in the background of this picture is my mother-in-law. And I just want to point out that she is playing a first-person shooter game in the arcade right outside the bowling alley with my son. So I wanted to memorialize this moment because if anybody knows my mother-in-law, you know how incredibly shocking it is to see that she actually agreed to play a first-person shooter game. That's Halo. I do believe she died pretty quickly in that game. But anyway, we went bowling, we had a great time, and that's how we're managing in the age of COVID.
Dr. Gloria, I have to say that was the most surprising ending on a personal note that we could have expected. And I hope actually that our listeners take away 2 things. One, that you can do this and you can do it safely, and you continue to be engaged with those that you love and do so safely. So we're glad that he had a happy 11th birthday. My question is, what games did you play?
I did not play any games. For some reason, the kids let me slide. I'm thankful for that.
All right, well, our listeners have not let you slide when it comes to questions.
Okay.
So let's quickly pull up, if we can, Katie and Faith, this slide. And for our audience, this is just an overview of how you can submit a question. And it's pointing to that chat box on the right side of your computer. Simply click on the question mark, look for that chat box, type in your question, click send, and then it will automatically come to us and we will read your questions. And if you want the question to go to one of us in particular, it's great if you go ahead and designate that, though it's pretty clear that anything that is medical or clinical is going to go straight to the expert on this show, and that's Dr. Gloria. We do have a question that actually came in, and I'll pose it now. You talked about the availability of the next round of boosters. Is there any information or data that indicates that Pfizer or Moderna has longer staying power or is safer?
Oh, when you compare Pfizer and Moderna to each other, not really. Yeah, not really. I think one or the other has performed a little bit better against certain variants, but given that they're both going to be reformulating to target Omicron, I think it's going to be hard to know if one's going to outperform the other.
Okay. And then there was a question about any other preventive steps that we can take to defend against the new variants that might be additive beyond what we needed to do for prior variants?
One thing I realized I forgot to mention, probably totally unrelated, but do remember, everyone, before you touch your mask and after you touch your mask, to wash your hands, because you don't want to contaminate your mask with whatever's on your hands. And you also have to remember that if you are in an area where there are COVID particles in the air, the front of your mask is going to be contaminated. So when you take it off your face, you want to make sure you wash it afterward. Getting back to further mitigation strategies, I think that it's really important for all of us to have in mind that the guidance that we followed in the past, again, I mentioned already, you know, that we could keep our visits to less than 15 minutes, maybe we could be outside and that would reduce our risk, doesn't hold true for BA.5. It is extremely transmissible. So if you're someone who is really, really not wanting to take any risks, I think you should be really careful even about outdoor meetings or gatherings.
Okay. So another question, and this relates to the rollout of additional boosters and or what may be new vaccines in the future. And we can recall that in the past, the pharmaceutical companies partnered with senior living organizations such as Goodwin Living. And we were able to introduce those vaccines on campus for our residents, invite our Goodwin Living members, Goodwin Living at Home members to come in. Will there be similar rollout plans and coordination with senior living communities, or will this go down a different path, do you think?
I think that the rollout coordination with pharmacies, particularly for the mRNA vaccines, which are the Pfizer and the Moderna vaccines, are probably so well established at this point that I don't see a huge need to be organizing with senior living organizations. The one caveat to that is when somebody is homebound and not able to get out to one of the pharmacies to get a vaccine. And in that case, the health department has done a good job of making sure that somebody can actually come to your home to vaccinate you if you're homebound.
What about older adults who don't live in a senior living community? They may live in their home, whether that's a single family home, a condo, or a townhouse community, and they're independent. They're not part of any senior living or senior services organization. Would they be going to local pharmacies, local health departments?
Yeah, either option. And I think for me personally, the local pharmacies have been where I've gone for my boosters and taken my family members for boosters, just because it is the most easy and convenient thing to do. You can certainly schedule with the health department if for whatever reason you're not able to find availability at a local pharmacy. But they did a pretty good job of rolling out the boosters so far. And when I say the health department, keep in mind, in some cases, when there's a new vaccine rollout or a new booster that's been recommended, the health department opens up additional sites. And so they may open up a site and you can, visit that site or go to a pharmacy.
Okay. Another question came in. This is about test kits. What should people do with test kits if they've expired?
Oh, that's such a great question. Dr. Gloria has this very stubborn attitude about expiration dates, and I will tell you, I have medicine in my medicine cabinet from like 2006. That's not how you should live your lives. That's just how I live my life. Generally speaking, if you have a test kit that's expired, it should be tossed. But before you toss it, do make sure to look at the manufacturer's website, because some of these expiration dates have actually been extended. So the expiration date that's printed on the box may not actually be the expiration date if the manufacturer has extended it.
Okay, so we have another question, and this relates to the demonstration that you provided of the mask. And the individual that submitted it is pointing out that there can be gaps on the sides. And there also is what, and I'm going to editorialize here, but I think it's user error. When the user is not wearing the mask properly, it may slide below their nose. And so the question is, why would Goodwin Living or any other senior living organizations require surgical masks rather than the KN95 or N95, given that there is this vulnerability?
And that's absolutely true. I'll tell you from personal experience, when I wear my surgical mask, again, I don't wear KN95s in general because they don't fit me, but when I wear my surgical mask, I take my mask off, my face looks fine. And you could probably all notice when I took this respirator off my face, you could already see the indentation on my face from the respirator because it seals so tightly to my face. So yes, there is a real difference between the seal in an N95 and even a KN95 or a surgical mask. The reason that we still require surgical masks is because it's not going to protect you, the wearer, because you're breathing, you're inhaling around it, but it does reduce the risk of spreading COVID-19. It helps us just a little bit. So if you have COVID-19 and you're exhaling the particles into the mask, it's a little bit more likely to catch them.
Okay. There was another question that was posed, and this relates to what have been the rates of infection and the rates of mortality across Goodwin Living. And we have previously reported that fairly extensively. There is, on our website, we have a dedicated section where every week we posted what our numbers were, our case counts, since March. So we then migrated from weekly to about bi-weekly or monthly, depending on the state of the pandemic. What I thought it would be most helpful to do, rather than try to go back and give people week by week by week, which is a lot, is just to say, where are we today? And as of today, at Goodwin House Alexandria, there are 4 residents that are COVID positive and 2 staff members. At Goodwin House Bailey's Crossroads, there are 4 residents positive and 12 staff members. And what we can tell you is that in some instances, there have been runny noses, there have been colds, there have been the symptoms which suggested better get tested and test confirmed COVID positive. There have been other instances where people had no idea and no symptoms and they were COVID positive. So what that tells us is always better safe than sorry if you do have or exhibit any of the symptoms and if you've had any exposure. And we'll tell you that the first word that we used when we described what is Goodwin Living's approach to the pandemic and keeping those we serve and those who serve safe and well was conservative. And I'm going to give you an example of conservative. Recently, we had in one of our communities, 2 members of the dining services team test positive because they had had overall exposure to a number of other dining services team members. We made the decision to suspend our communal dining for a brief period of time, and we did room service delivery until we felt that everyone was safe and well. Now, that's a very conservative approach because the other individuals in dining services were exposed, but not necessarily positive. We chose to go conservative with that approach. I think that covers our questions that we have received up to this point. It may look like there's one more that's just come in, so bear with me. We're using phones and all the best technology devices. Okay. This question is, please repeat the website where we can be sure the masks being sold are what they say they are. So if you could repeat that website address, Dr. Gloria.
Yeah, sure. It's projectn95.org. You can also just Google N95 project, but it's projectn95.org.
Okay. Well, thank you very much, Dr. Gloria, as always, for being as informative, knowledgeable, calm, open to questions as you are. And we're now going to close up with just a few brief slides. So if we can transition to a slide that's going to share with you some ways that you can continue to learn about Goodwin Living and the services that we offer. This next slide is upcoming events for our Goodwin Living at Home program. And you'll see there's one on August 18th from 11:30 to 1. And then there's one that's taking place on August 24 and August 25. These are in 2 different locations, so they're convenient for any of you who would like to learn about aging in place in your home with the financial support of that long-term care like life care contract, as well as overall care coordination for all of your care needs. You can learn more about these events at the website listed at the very end of this slide, which is goodwinliving.org/events. And for those of you who generally want to learn more about Goodwin Living, there's a wealth of information at our website, and the overall address is goodwinliving.org. You'll learn about events. You can learn about stronger memory. And there are many podcasts from the past, webinars from the past, and resources that are available for older adults with purposeful, fulfilling, fun, and healthy living. That concludes our program for today, and we are so grateful that you wanted to join us. If you have any follow-up questions, you'll see on this slide right now a telephone number, 703-578-7201, or you can email us at info@goodwinliving.org. Thank you again for joining us. Please stay safe and stay well, and have a wonderful afternoon. This concludes our program and completes the recording. Thank you.